when you're talking about care delivery, being able to ensure that phone call goes through, that alert goes through. We're talking about patient safety at that point. Yes, they have ancillary backup systems, but it's mission critical to make sure that event of communication gets to the correct end user at the correct time, and it's handled accordingly. Because if not, it can lead to a life and death situation for a patient.
Welcome to Beyond the Blueprint, a podcast designed to empower healthcare professionals, enabling them to improve care delivery through integrated design and technology innovation. My name is Greg Malkery, and joining me is my co-host Keith Washington. Whether you're redesigning a hospital, launching a new digital initiative, or just curious about the future of healthcare, then you're in the right place. Let's explore together what's possible when we go beyond the blueprint. Well, today we do in fact have an exciting topic. It's how CPaaS, also known as Communications Platform as a Service, is helping transform healthcare communications. And today we have a nationally recognized healthcare telecommunications expert, Myron Wallace. Myron, welcome to our webinar. Would you like to start by telling us about your background and how you got involved in this field?
Yeah, thanks, Greg and Keith, for the opportunity to be here. It's great to participate on this series with you guys. I didn't really start in the traditional sphere of healthcare. I started as a network guy, in the land of communications, and then got more involved in network services, but always on the front edge of communication-specific technologies. And where I really got exposed to the healthcare market was when I took an opportunity to work with a company called Doc Halo at the time, which is now part of Simpler. That really transformed my understanding of, the healthcare environment, the challenges around that, the technologies utilized, and, really defined emerging opportunities for, this thing as we talk about next gen collaboration. So, recently worked with Tiger Connect and had a great opportunity to work with them, learned a ton about, different environments they were in. And, that led me to, starting my own consultancy about a year ago. So now I'm working with, software solutions that go into the healthcare environment, as well as the clinical mobility aspects from Zebra and other solutions that are really transforming the way we think about care delivery in a modern day. So great topic to talk about today. Really looking forward to diving in with you on the team here.
Oh, great. Thank you, Myron. Keith, do you have any opening remarks for today?
Yeah, Greg. So thanks. Just want to go a little deeper on how Beyond the Blueprint, what we're trying to do is bring together thought leaders and explore how design can help manage complexity and enhance patient care, and that a good design really not only aligns an organization with their core mission, but it also can help promote flexibility, transparency, collaboration. And I think what we're trying to do is address both the opportunities and the challenges through conversations with industry thought leaders, talking about integration, co-creation, systems, how to empower staff. So I think this platform really is looking for those insights, as you said, and really trying to help care teams focus on like effective communications, systematic design. So I think today's topic is a great example.
Great. Thank you, Keith. Now, before we dive into today's discussion, I want to recognize our valued sponsors who've made Beyond the Blueprint possible, Storage Systems and Simplify Medical. With their support, we're able to bring you insightful conversations around healthcare design and innovation. If you enjoyed today's show, I encourage you to subscribe so you never miss a future episode. Myron, want me to get into this? Let's start off with the basics. What exactly is Communications Platform as a Service, and why is it important for the healthcare industry today?
Yeah, so all these technologies that we utilize and leverage in the clinical environment use some type of platform as a service. They call that market PaaS. PaaS is another term. So they kind of get molded into. Then they put the connotation at the front to say communication or or web platform as a service, et cetera. So there's a lot of different ways to look at platform as a service. But underlying, these solutions that we utilize are built upon AWS, Azure, Google Cloud, and other technologies. So the communication element is kind of in that sphere of programmable access for developers to take components of it and build experiences to drive, end user outcomes, with their applications. So why it's important and kind of what's going on in that sphere is we're embarking on the next chapter of, I think, care delivery and what we're referring to as virtual nursing. Virtual nursing is on the rise due to the staffing shortages that are occurring in the market, as well as just the caregiver burden, that they have to endure with these applications. We got there with messaging. We continue to evolve, with clinical mobility. But that's a really big component of, these underlying technologies. So to unpack just a little bit further, when you think about communication platform as a service, we've all interacted with an Uber or a Lyft, type experience where, we've got a message from our driver, and it says, hey, I'm going to be there in 10 minutes. Some of that's transformed into the app experience, but largely it was delivered over an SMS or some type of messaging experience to the end user. Same kind of goes on in the healthcare sphere. But then you start getting into the other highly adjacent aspects of that, which are, voice and then video. Video became, popular with teledoc, and, the pandemic really kind of stapled home, virtual collaboration for healthcare. But those technologies all rely on CPaaS type frameworks from providers in the industry. One of the companies I've been working with recently, called White Label Communications, is really, transforming the way we look at, like programmable communication technologies for voice, and then getting into some of those messaging functions. But there's a big opportunity to build more services around these types of applications.
Great. Thanks, Myron. How does a solid systematic design help seamlessly integrate emerging communications technologies like CPaaS within different healthcare settings?
Well, it all starts with infrastructure. We can't do any of this without solid infrastructure. It's always been a challenge because, you have lead line walls in radiology areas, and, how do you get, wireless signals into those rooms so you can provide, same level of experience for your care teams that are using these types of, mobility technologies. But now we're kind of entering the next chapter of infrastructure in these environments where we're seeing private band 5G networks. So think of, we have 5G smartphones now, that's getting extended into the four walls, which is a really exciting opportunity, for the health systems to be considering, hey, we should really look at, transitioning away from traditional fixed wireless, for our delivery mechanisms. And we should focus on the 5G networks. One of the networks I've been really following really closely is T-Mobile. They've done a really fantastic job, I think, getting into more of that opportunity, of delivering private band 5G experiences. There are kind of some things, that are evolving called neutral host networks. And what that means is you can deliver 5G connectivity, to whether, Verizon, AT&T, T-Mobile, et cetera, any of the networks can access the device. Devices can't access it, I should say it that way.
Great. So Myron, I just a kind of a maybe stepping back a second on some of the language here, the technology, and maybe speak a little bit to, let's say, like our nurse audience. So who don't sit here and think about, well, even all the letters in the acronym, right? So you've got platform as a service. So I guess help us understand the benefits to the organization, because I understand it, like a lot of this is you're thinking about it as a business model and you're leveraging infrastructure, but just say you're a nurse, like, why do you care? Like, what does that mean?
Well, the nurse really cares about, having access to the device and the device functioning. Last thing that they want is the device to be given to them. and then not function on the network. It's very frustrating, and they throw them in the drawer and they forget about the technology and they go back to the way that they've always been doing care delivery because it's too frustrating. So having the network in place to be able to empower the clinical mobility on the actual device, and then the application that goes on that device, all those things are stitched together and create the platform as a service, if we think about it, through that lens. So it takes a circus of three, as I like to say, to be able to deliver really solid experiences.
Right. So just maybe say it a little differently. So by doing the integration, by making sure all the things work, they're less likely to get frustrated and throw the device into a drawer. Yeah. So this is, and I think this is always important. We talk about this on Beyond the Blueprint, where partners, say technology partners behind the scenes, are working on behalf of the nurse so they can practice their clinical work without all the distraction of the tech, getting in the way.
Yeah, we're in this really interesting time. I call it a SaaS sprawl. And what I mean by that is you look at the clinical mobility device and they roll them out and they have 20, 30 apps on them sometimes. And it's like, what is all this? So like, how do we streamline the experience down so they're not doing the swivel chair between, well, I got to go to this application for this function. I got to exit that. I got to copy. I got to paste the information in over here because there's no linkage between, the applications. And that's extremely frustrating and complicated for the end user because, you're supposed to be able to simply click things, input data, and move on to the next thing. And if the application is not designed with that in mind, you're adding to the burden in the workflow, which is really a problematic thing.
Yeah, exactly. No, yeah, I appreciate that. And I think that's what we're trying to have these kind of conversations, say, to encourage the nurses in our audience to contribute to this conversation, that they, that it's not like some magic wand that we can wave and everything just goes together seamlessly. It does take some, back and forth and some iteration and that really participation by everybody in the organization on what like consistent high quality communications means to them, and not, again, just getting frustrated and saying we got to go back to the old way.
Yeah. And that's often what happens. Like I said, they throw the devices in the drawer and then they forget about it. And then you're doing a clinical adoption study to figure out, why are the technologies not being adopted, what the pain points are.
Right.
When you get to the root of it, it's like, well, the thing doesn't work. We threw it in a drawer because we don't want to deal with it. And we want to go back to our other way because it's quick and easy and we can move on to the next task and get our day done. So, I mean, onboarding that shift change is such a crucial thing for the nursing staff. They don't want to have to deal with, when I pick up the device, signing into 50 different applications. They want to be able to, if they're using something like Imprivata, where our Blue Fletch, where they tap some type of badge on the back of the device and they do some biometric authentication, and onboards them, they're ready to go. And at the end, they tap out and they hand it to the next person or on to the next task. That's the way that the technology has to work across all the devices in the world.
Yeah, well, thanks for that. I think that's good context. Appreciate it.
Mark, maybe we can pivot back. I'd like to talk about some of the major challenges that healthcare organizations face as it relates to communications and how these challenges are impacting patient care or hospital operations.
Yeah, I think if we start with the operation piece, so much of the technology that exists in the four walls of the health systems are, deployed on Cisco type technologies, and Cisco, they've done a good job in the market, but to me, the modern day hospital is not going to be all in on Cisco everything. So I think there's a convergence happening where, there's highly capable technologies that we can deploy from some of these bespoke type vendors that are in market today that not only increase operational throughput from the technologies, but it also saves them a significant amount of money on the services that they were paying to, the big guys like Cisco in the market. Not saying anything bad about them, but it's time for a transition in the industry. And 5G from, these solution providers, that are providing these solutions is the pathway of the future for connectivity in the four walls. And I've said it, earlier, it all starts with connectivity. If you have the solid connectivity, everything harmoniously works in the infrastructure. So it has to be paramount in the decision on what you're doing to roll out clinical mobility and these types of solutions from Zebra and others in the market that are really hyper focused on delivering that experience to our end users.
Well, yeah, and I think just maybe to amplify that a little bit, Myron, the difference. So, like as a consumer in consumer tech, I mean, everybody's used to poor connectivity wherever you're going, but you can't do that in an industrial enterprise application. It's just not something you could tolerate, right? So it's almost like you got to get people to understand, like, look, this is different than your consumer world. Like, this is serious business.
It's it's mission critical. And when you're talking about care delivery, being able to ensure that phone call goes through, that alert goes through, we're talking about patient safety at that point. Yes, they have ancillary backup systems, but it's mission critical to make sure that event of communication gets to the correct end user at the correct time, and it's handled accordingly. Because if not, it creates, it could lead to a life and death situation for a patient. So it's very, very important. And I think, the consumer grade devices that have entered the healthcare sphere, there's a big, many health systems, a big push for the Apple-esque solution. But it doesn't work. I mean, you're gonna refresh the devices. People steal them because they think they're a consumer grade device and they're not locked down. Whereas, who's going to want to take an actual device that's purpose built for healthcare out of the four walls?
Right.
Highly not likely. But those devices provide a different level of experience too for the end user, being able to do, the barcode scanning for meds administration, transport, EVS, whatever workflows that you have that are, need that physical barcode scanning engine that are on these purpose-built devices. It makes a big difference having the right tech. It's like a tradesman showing up to the job, and saying, hey, I've got a screwdriver and a pair of pliers. I can fix anything. Well, the reality is, sure, you probably can, but you're not going to do it efficiently and you're not going to do it the right way. It's going to be put in not correct at the end of the day. I think that it happens in technology all the time.
Yeah, it does. No, there's a lot of crossover. And I think there is, like you said, that experience of ease of use because the consumer is comfortable in a particular environment, but then, kind of overlooking all the benefits of a more purpose-built solution and how that really applies to the enterprise and all the different, teams that have to work together, right? It's not just, that's, I think, a big difference where consumer, you're just worrying about your own, small circle where, you may have an organization with 80,000 people. That's a whole different level problem.
Yeah.
Hey, Myron, you brought up 5G a number of times. Can you elaborate a little bit on how widespread is 5G being deployed, and what are the implications on bandwidth-heavy applications like video consultations? How pervasive is it? Is it more just in the press, or is it a reality today based on what you're seeing in industry?
It's a reality. It's very new. It's been there for a while. It started out as what they call CBRS, and which is basically think of it as just a private, LTE network, for devices to connect. So it basically your clinical mobility devices have a SIM card in them, and then they attach to that network on a private spectrum is how it works. And they get rolled out inside the enterprise, and that connectivity spans the entire organization. It's not a widely in market yet, but we are starting to see more trends in the market where this is the pathway for rolling out clinical mobility due to the heavy, intense nature of the communication traffic. I think specifically what is a big driver behind that is the virtual nursing aspect, because the patient bedside experience is turning into more of a concierge type approach. And there's more need for video applications around those types of solutions in market. And that means that you're going to need higher throughput and connectivity. The Wi-Fi network is not really built to handle that amount of traffic all at once. Having the private 5G network is the pathway and conduit to allow those types of applications to function.
So it sounds like
sorry, Guy, I was just going to make a comment there. So, Myron, would you say that that's a parallel, like an analogy to the purpose-built device? This is like a purpose-built infrastructure. So it's designed specifically for that kind of enterprise communication and connectivity?
Yeah, that's a really good way to phrase that. Haven't really thought of it through that lens, but yeah, that's exactly what it is, in my opinion.
So as you look at the CPaaS with the use of 5G, how does this relate as you look at large healthcare system deployments across multiple facilities, or even more advanced care models with hospital at home? How is it addressing these types of issues?
So patients, if they have some type of monitoring device that they need to be sent home with, we're living in a very connected world. We wear smartwatches. We have, remote patient monitoring, applications now in market. So if the patient is sent home with a device, instead of that device, not being able to connect back to provide the data that's relevant for the patient, having the transition from in the four walls to the home setting is seamless to the end user, which is what you want. Last thing you want is to send the end user home, with a, our patient, I say end user, but actually the patient home, with a device, and then they have to connect it to their Wi-Fi, or they have some type of other challenges around that. You want it to be as seamless as possible. It's think about like the connected car in a way. Like our cars report back so much analytic to the manufacturers. How we drive them, how often we drive them, how fast we drive them. Same thing happens within these types of applications for remote patient monitoring inside the home setting. So that's where kind of the drive and having, these next gen infrastructures for healthcare is going to pave the pathway, for having that seamless experience for the patient and the hospital itself.
Now, when we look at CPaaS, how widely deployed is CPaaS? Many of those in our audience might not be familiar, but is it widely deployed, or is this an emerging platform of which many of these CC&C vendors are redeveloping their strategies or solutions? And what are the implications of implementing these emerging platforms?
Yeah, CPaaS has been around for quite a number of years now as a term in the industry. Most of the market thinks of CPaaS as messaging and maybe some video elements, but there's a lot more to that. You have, messaging, video, chat bots, you have email, campaign management, push notifications. Those are all capabilities within CPaaS. So health systems are leveraging CPaaS under the hood of solutions that they buy and market, from the CC&C vendors. It doesn't have every single thing in there that I just highlighted to a degree, but I think healthcare systems, the enterprises, will want to start to leverage these types of technologies that are in market, so they can get away from the big iron providers that have been there, like Cisco and et cetera, because that infrastructure is aging out. And the modern day health system, it's not going to be based on that type of technology. It's going to be based on a mixture of technologies that come together. I think that's where, we're in a bespoke period of time. I mean, you can go on Nike and design a pair of tennis shoes and get them made to your exact color and specifications. The same with software. We live in a very prolific time where, you have access to software developers that can build software experiences around whatever you're trying to solve. And I think healthcare systems will start to leverage that type of approach that are more in the innovative side, that have, the wherewithal and the budgets to build applications that, don't meet the needs of their particular workflows that they can get off the shelf. So, solutions are in market, they may solve one gap, but they don't stitch together everything that they need, because they have back to that SaaS sprawl comment. It's like, how do we actually simplify this for our end users and drive more meaningful experiences? So it's a bit very complicated, to get deep down in the tech, but that's what it, will happen in the next 10 years for sure.
Yeah. So I guess then in managing all that complexity, maybe that's a little bit of the idea of these larger health systems getting larger, right? They were more independent hospitals. Now they're consolidating into larger health systems. Would you say they're getting better at articulating the problem and maybe thinking about the CPaaS as more of an enterprise solution because now they're having to act more like a large, sophisticated enterprise?
I think it's starting to change. I don't think all the health systems are there yet. I think there's a few in the market that are more innovative in thinking about, how to leverage these next gen services. But it goes back to one thing when I first got involved in healthcare that I was really kind of mesmerized is the way to describe how I thought about it was health systems collaborate with one another. They want to help each other out. So, there's a consortium of health systems that are kind of coming together to say, this is what we're doing over here. It's working for us. This may work for you. And I think that type of collaboration breeds, other innovators to come to market and say, we can do the same over here on our side. And that's the future. One of the things that I feel like Halo did extremely really well in my era of time and working with them, they had a really strong clinical advisory board. And it opened up my eyes because it was comprised of, docs, nurses, informaticists, industry consultants, market analysts, and it was a wide array of conversations. So it helped us really define product market fit. And, reality is if health systems are going to leverage these technologies, they're doing the same type of approach, amongst themselves to build out the product market fit that they need to drive the experience or, the different outcomes that they need in their environment.
Okay. Yeah. So maybe another way I would say it then, it's not about size and scale of the organization. It's more about let's say a maturity in clinicians coming together because they like to do that, right? They like to share best practice and they've had time to do that, say in the tech stack in the informatics realm. So now we're starting to see the benefit of that. Is that another way to say it? Okay.
Absolutely.
Hey, Mark, can you give us a bird's eye view? What do you see over the next 18 to 24 months as it relates to CPaaS? How do you see things evolving? What are some of those short to midterm opportunities?
I think more businesses will start to assess what they're doing with communications in their environment and where are there opportunities to provide different levels of engagement through patient outreach, patient experiences, through the different technologies. And, back to the SaaS sprawl, there's obviously, when the financial teams get involved, they start to figure out, okay, how can we make things more cost efficient inside our organization? So where can we chop some things out? And, that leads to other innovative conversations around, okay, these types of technologies we can put together. But I think, one of the big drivers inside of CPaaS itself is, at the technology stack is the virtual collaboration around virtual nursing. I'm really excited to see where that goes in the next 18 to 24 months. Just because with AI being able to use machine vision and some of the other solutions that are in market will change, the paradigm in that actual type of application. And specifically around virtual nursing or virtual concierge services for at the patient bedside, that's going to completely dramatically change in the next, I think, I'm going to say 5 years on that one. I think it will take a little bit of time, but I think we'll start to see entry in market, of solutions in the next 24 months around those technologies, but it will get really refined, in about a 5-year period. There's a lot of solutions. You've seen Care AI and some of those applications where AI is inserted into everything at the moment, which is interesting. But I think there's a lot of interesting use cases to come out of AI with CPaaS and some of these communication applications.
Great. Well, Myron, I want to thank you for sharing your time, insights, and perspectives. I also want to thank our sponsors, Storage Systems and Simplify Medical, for making this conversation possible. Myron, do you have any final thoughts for health IT professionals looking to integrate CPaaS into their systems?
I would say, look at your infrastructure, map out your infrastructure. What are you using currently for different communications, including, your CCNC solutions, your virtual nursing applications, your telecollaboration suites. Figure out what you're using and where you can match the workflows and how you might consolidate them and look at a modern day communication approach. But then also don't forget the infrastructure piece of, leveraging, some of these new things with 5G that's coming out in market. Be sure to look at, who's going to provide you the best continuity of solution, that's going to actually, drive the experience that you're going to need, to deploy these types of applications in your infrastructure. That's it. It's there to an obvious degree, but I think it's one of those things that, everyone seems to approach a market thinking Wi-Fi can do it, but the reality is it's not built for that unless you kind of overhaul your entire network, which takes millions and millions of dollars to do so. And once you rip out what you have to fine tune for the future again. So there's a lot more involved in it than what meets the eye sometimes. So I think just creating that map of what you're doing and then figuring out, what is the highest priority on the outcome-driven side and working your way back into the tech and coming up with that list of priorities.
Wow, great, Myron. My big takeaway from today's session is that CPaaS, when used with 5G, I think really seems to be poised to revolutionize healthcare, especially on real-time collaboration and improving care. But this has been really informative for myself. Keith, what final thoughts would you like to share for today?
Yeah, no, I want to thank Myron for sharing his expertise in enterprise class tech leadership to help drive standardization. I think, this conversation had some really valuable insights on how systematic design with a focus on connectivity and infrastructure really helps streamline communications and enhance the clinical efficiency and ultimately improves outcomes. So I also I want to thank our audience for joining us here on the journey of Beyond the Blueprint. I really hope that this discussion inspires our leaders to go and really focus on their communications platforms to understand better how they can create care teams that are coordinated and delivering more patient-centered care. So, and share with your organization, like really spend some time focusing on this. I think it's a really important topic. And I hope Myron will come back and just keep this conversation going. I think there's a lot more to talk about here, particularly as it, is rolled out over time.
Great. Thank you, Keith.
All right. Happy to be back at the time, guys. Let me know.
Great.
Yeah. Thank you for listening to Beyond the Blueprint. Together, we're exploring how thoughtful design can simplify complexity, enhance patient care, and create meaningful change. If you found value in today's episode, make sure to subscribe and leave a review in order to help us continue the conversation. Let's reimagine healthcare together on Beyond the Blueprint.